Hi, my name is Paige. I'm going to be completing my head-to-toe assignment today for my virtual clinic day. This is my roommate, Maddie. She'll be my patient. So the 6 steps that I'm going to do first are introduce myself, make sure I gather all my supplies, provide privacy, hand hygiene, confirm my patient, and then also explain the procedure. So to start, I'm going to knock on the door, introduce myself. Hi, my name is Paige. I'll be your nurse today. Can you tell me your name and date of birth?
Maddie Smith, April 10, 2006.
Perfect. So today we'll be completing a head-to-toe assessment. I'll be asking you questions and also doing some vital signs. Can you tell me, so you told me your name, date of birth. Can you tell me where you are today?
Iowa Central.
Perfect. Can you tell me what time it is?
No.
No?
2 o'clock.
2 o'clock? Yes, it is. It's okay. There's no clocks in here. So with that, I was just checking to make sure like how alert she is. So she is alert ×3. I would also complete her vital signs first thing. So her blood pressure, the normal range should be 120/80 to 90/60. Her respiration should be 12 to 20 per minute. Her temperature should be 98.6 to 100.4. Her oxygen level should be 90 to 100. And her pulse should be 60 to 100. And then also the 6th one is pain. Maddie, are you experiencing any pain today?
No.
Okay. Next, I'm going to complete the PERLA. Pupils are equal, round, and reactive to light and accommodations. Okay, so just look straight ahead. I'm going to shine the light to your eyes. So with that, I'm just seeing how much your eyes dilate, and if they do dilate, does one eye dilate and the other doesn't? So I would say that hers dilated from a 4 to a 3. Now we're going to do the accommodation part. Okay, ready? Just move your eyes, not your head. Okay, ready? So with that, I'm just looking at like how her eyes move. Are they normal or are they showing abnormalities like being slow or even shaky with movement? Maddie, are you having any trouble seeing today?
No.
What about any troubles hearing?
No.
Can you move your head like you're saying yes? What about no? Are you having any pain with that?
No.
Okay. So next, I am going to move to the abdominal region. So we're gonna start with her bowel sounds. There are 4 quadrants. You're gonna use your belly button to mark the 4 quadrants. I'm gonna start in the right lower quadrant, which on Maddie would be this quadrant. You're gonna listen in 2 different spots, but you're gonna listen for a minute each in each quadrant. So a total of 4 minutes. So Maddie, I do have to lift your shirt up. Is that okay?
Yep.
30 seconds left. Perfect. We'll listen to your lung sounds next. So with that, I determined that her bowel sounds were active because I heard a noise every 5 to 20 seconds in each quadrant. Hyperactive, I would be hearing a noise every 3 seconds. Hypoactive, I would hear a noise every once per minute. And then not active at all, I would not hear anything. And then with that case, I would need to oscillate for 3 to 5 minutes in that quadrant. And if I still didn't hear anything, I need to report it to the provider right away. So I'm gonna listen to her lung sounds next. That's gonna be 8 on the front and 10 on the back. I'm gonna make sure I listen to see if her lungs are clear, if there's any wheezing, or any other abnormal sounds. Now I'm gonna listen to the back for 10 different spots. So just take a deep breath each time I move it. So her lung sounds were clear. Now I'm gonna listen to her apical pulse. So Maddie, I do kind of have to touch your chest and put my stethoscope on the inside of your shirt. So for this, you are going to locate the angle of Louis, which is about right here, this little. And then I'm gonna go down to the 5th intercostal space. And then I'm gonna locate the mid clavicle. So I locate her clavicle right here, and then the middle of it. And I'm gonna go to where those two meet. So for women, this is typically kind of right under the breast. So it's just important that you are communicating with your patient and telling them what you are doing before you do it. So for this, I would listen for a full minute, and I would want to count how many beats I hear, and I would want to compare it to what I got for the radial pulse because they should be within the same range. Okay, so now I'm gonna ask her a couple of questions. Maddie, when's your last bowel movement?
Yesterday.
Was there anything abnormal about it?
No.
No. Are you having regular bowel movements?
Yes.
Okay, what about urinating? Is it normal?
No.
You're not experiencing any pain or
Mm-hmm.
frequency?
No.
Okay, perfect. Now I'm gonna do the range of motion with her. So I'm gonna do her arms and fingers first. Okay, so do you wanna kind of bend your fingers like that? Your wrist, do it in a circle, like that. Okay, now your elbows. With your arms, do you wanna go like that? And then kind of flip. Can you do it in a full circular motion? Can you go the other direction? Okay, perfect. So now hold your hand out like this, straight up. I'm gonna push on it and you are going to push up. Try not to let me move your hands. Okay, perfect. Now I'm gonna do the opposite direction. So for this, it's important to make sure that she is having like equally strength on each arms. This is important for like a patient who has suffered a stroke. And then for her range of motion, it's important to make sure that she still has range of motion, but also that she does not have any pain with it. So now we're going to do range of motion with her bottom half. Do you want to kind of do the same motion with your toes? There you go. What about circular motion with your ankles? Yep, can you do the other way? Perfect. So now I'm going to put the pressure on your feet, and you're just going to do the same thing we did for your hands. So I'm push down. Okay, perfect. So now, do you want to extend your knees? Yep, there you go. You can just push them straight. There you go. So next, I'm just gonna, like, throughout this whole head to toe assessment, I would be looking at her skin. Is it like pink? Is it dry? Is it moist? Is it soft? Does she have any lesions or bruising? And I noticed that Maddie does not. I would feel her skin. Her skin is soft. It is warm. Another important thing to check is for your skin tuger to see how hydrated she is. So I'm going to check on that clavicle bone. So I'm just going to pinch a little piece of your skin. So it was not tinted. Next, I am going to check to make her capillary refill. I'm just going to pinch on 2 fingers on each hand. Making sure that her color does return less than 3 seconds. I'm also going to check to make sure she has any edema, and I'm going to especially check that with the feet, and I do not feel any or see any. So next, I will be checking her dorsal pedis pulse and also her posterior tibula. So with that, the dorsal, you're going to check right along like this bone. And you're not going to do it for a certain amount of time. You're just going to do it for the strength. And that is 0 to 4. Okay, now I'm going to, I would rank those both a +2. And then I would rank those a +2 as well. And then I'm also going to do the capillary refill on her toes. So Maddie, is it okay if I take yourself though? Yeah. Okay. It's okay. It's okay. So again, I'm going to do 2 toes, making sure that the color returns within 3 seconds. Which it does. So that will conclude my head to toe assessment. And throughout this head to toe assessment, normally like I would have a piece of paper and I would be documenting it all, but I just noticed that you couldn't have any paper, so I just decided not to have that. Thank you.